Hey everyone, I kind of wanted to talk to you about kind of a nurse's journey with coronavirus. I know there's a lot of misinformation out there. I know there's a lot of people that are scared, and I understand that, and I don't want to scare anyone with this. I am a brand new nurse. I actually just finished orientation, and this kind of all started. So today was my first day actually working with in the hospital with the new coronavirus precautions. Now, I can't say what hospital I work for, of course, but I kind of wanted to, shed a little light on the healthcare perspective of it. So currently, like in my hospital, there are no visitors allowed. So that helps kind of, I know, people can want to visit their family members, but in this time, it's really important that we eliminate as many people non-essential as possible. Of course, if people are on hospice or labor and delivery, or they have a child, they do get allowed one permanent visitor, but everyone else, it's not needed, and that's definitely okay. As a healthcare worker, I've noticed, multiple reports from around the country that supplies are running low when it comes to mask, gowns, or PPE to kind of keep us protected from the droplets, because people with the coronavirus, when they cough out, that can stick to your clothing or something, or to your face. So we have the mask, and it has a shield on it to kind of prevent any droplets from getting into our face and our eyes. And then as well as a gown is to prevent it from getting on our gowns as well. So we tossed all that. We learned about the certain precautions with that, how to properly take it off. People are taking it really seriously, which is a good thing. This is definitely something new. And, if you are visiting a hospital or something, or you're frustrated with the healthcare right now, please try to be compassionate. We're very compassionate towards our patients and families, but this is a time for us where we're nervous too. So if people who are calling or anything, or even the patients, would just give us some compassion and understanding, I think that would really help the situation too, because everyone's a little nervous. Me, from being the unexperienced new nurse all the way up to my experienced nurses who I look up to. So everyone's a little nervous, and that's okay. It means that we're alert, and it means that we're not taking this lightly, and we're not just not taking it seriously. So that's a good thing. So it's been different. I went there last week, for my orientation. It was totally fine. And then this week, all of a sudden, there's a no visitor. There's all this stuff going on. People. So it's just different. Also, too, I've noticed, too, around, the country, coronavirus testing kits are running low, which is unfortunate, but a lot of people are trying to use them right now. Everyone wants a for sure positive, so they know kind of who to contact or something. But the thing of it is, if you don't get a coronavirus testing kit, you still could have it. So don't be thinking, oh, I don't have to take the test. Just because you don't take the test doesn't mean that you don't have it. A lot of the tests, at least in my area, they're trying to reserve for critically ill patients, so patients who are very elderly, patients who need to be on respiratory ventilators. So that's who they're reserving the test for. I've also seen other places too try with doing influenza testing, and if they were negative for influenza, then maybe it could be corona, and if it was positive for influenza, then it might not be corona. So that kind of thing. So it's been different out there. Everyone's running low. It's not just one place, and so just try to be compassionate. We need our supplies. As a healthcare worker, it's kind of, to see everyone online, oh, please stay home, which is good. But as a healthcare worker, or people who work in essential work, such as gas stations, grocery stores, pharmacies, testing lab, this is all essential work, and so you still have to go out. So I wanted to come up with a couple things that really work for me, and that I've used long before this pandemic ever started. I want to bring hope to people of ways that you can feel more confident not like cocky, but just more you feel better about what you're doing, because what we are dealing with is serious. We're taking it very seriously. You know, I was at the hospital all day, and I should say all night, and I'd never touched my eyes, face, nose, anywhere in my face whatsoever. And that takes a lot of self-control, and it takes a lot of awareness, but it's something that I think not just taking away from the coronavirus, but you should always do, especially at the hospital. I never touch my face at the hospital. Is it hard? Yes. Like my nose itched so much today, but I didn't itch it. I just went along with my life because that's just me. But I want to give you guys some tips kind of about what I have been doing even before the coronavirus that has really been helping me and just feel more safe, because, you know, we all have families and no one wants to bring home this to their family. You know, if you do have to leave for work or something, this is, you know, something that you can do to try to help yourself and therefore help the community as well. So I hope you guys like it, and please stay safe out there and stay alert, not anxious. Protect yourself and protect others. This is stuff you can use that I have used way before this pandemic ever started that has really helped my nursing career and my everyday personal life. So I hope you guys like it. Okay, so before I even go into my house, I wanted to let you guys know what I'm going to do, because I'm not going to like record it or anything. So when I have been going home from the hospital, I have been taking off all my clothes. So on the bottom of the stairwell, I have a laundry basket that has that I have my my house coats like on the side, and I've been stripping down, putting all my dirty clothes in there, so it's not even like entering my house or anything. And you know, and then I put on the house robe and go up to my room. So I've been doing that, and that's been helping me feel better about not bringing that into my house or anything. So that's what I'm gonna do. So I'm gonna change like my scrubs and everything. So I'm gonna strip down at the stairwell, put it in the laundry basket, so it's away from everyone, so no one can touch it or anything. And that's what I've been doing. Also too, I have been wearing glasses when I've been here, just because it reminds me like not to touch my eyes. And if you think like, oh, you're touching your face when you touch my glasses, like there's no mucous membrane right here. So if I touch it, and of course I sanitize it too, like alcohol swab it, my glasses right there, just so, you know, germs are killed. And I never do it with dirty hands. I always have clean hands. Yeah. Also too, I've been wearing my hair up so it's completely out of my face, so, you know, if a patient were, you know, to cough or something, it wouldn't get like all over my hair or anything. You know, with the donning of PPE, you're not supposed to have hair already on it. So I just keep it up and totally out of the way. Okay, so I wanted to give you a couple more tips too. So what I've been doing is I've been putting my phone in a plastic bag. I actually learned this from a nurse like a month ago, and like just a good way to kind of, you know, hospitals are gross in general, not just with the coronavirus. So I've just been putting my cell phone in a baggie. That way, you know, if I have to reach out and like use it during lunch or something, it's not, I don't feel as weird about it. So I've been really enjoying that. Another thing too that I always do that I get so grossed out by, you know, like everyone has their own ways. This is just my personal way of doing it. This is a different stethoscope, by the way. It's not the one I used at the hospital, so this is clean. So when I am doing my assessments on patients, I always alcohol swab before and after. So I will, like, I'll just pretend like this is an alcohol swab, so I'll just take it off, and I will rub the bell and any part that I think will touch the patient with an alcohol swab. And then I will do my assessment, listen to them, and then right after, alcohol swab, alcohol swab, alcohol swab. I've been doing this ever since I was, you know, nursing student, nurse intern, anything, and this has been really helping me kind of feel better. You know, I just get grossed out by stuff, so I've always done this, and it's been great for me. Otherwise, too, along with that, I've been using gloves for a lot of things. So basically when I go into a patient's room, I just put on a pair of gloves right away. You know, that could be picking up a patient's, you know, cup or something. if they sip out of the cup and you take it from the top, you're now exposing yourself to that. So I just always wear gloves. We have them luckily where I'm from, so whenever I go to a patient's room, just whenever, this isn't even with the coronavirus, I just always put on gloves if I know I'm going to do something or they ask me something. So whether it be medications, assessments, always for assessments I wear gloves. But that's kind of what I do. And then always wash hands after. So, but that stuff you guys kind of know. But I just thought there's some good tips because there's stuff that I've kind of learned along the way, stuff that I've always done. That has kind of helped me feel more comfortable. Yeah, so also oh crap, I forgot. I kind of have one with me. 1 second. Okay, so I've always done this because again, I get grossed out by stuff, but I use a water bottle that has a lid on it. So like this is from Target. I got lots of compliments on it too. So the mouthpiece is totally covered as soon as you put the cap on. I recommend doing this instead of something like, I know these are cute, but like, kind of the coffee glasses or like the blender bottles, because the mouthpiece that you drink out of is never really covered. So like even when you put the top on a blender bottle, like you still have like that part where you put it on your mouth and that's still being exposed to air and stuff. So stuff like this I wouldn't recommend. I recommend having, the bottle that like snap forward on top. There's like a plastic button you push and it opens up. Otherwise the screw-on lids where they're completely covered, as you can see, with that. So I've always done that. I've been the most comfortable with that. Otherwise I get grossed out again by stuff. But yeah. Or if you eat anything, eat a snack, I always put on gloves for that. And obviously don't type with my hand, so when I'll be typing and doing my charting with my right hand, I'll eat a granola bar with my left hand with a glove on, just because, I don't know, I'm weird. I've always done that though, but I think that would be a great help in this case. Also too, what I have seen, and what I don't like to see, is people touching their face. I know it's hard, please don't touch your face, okay? I don't care if your eyes are itchy or anything. Hospitals are gross anyway. I've never touch my face at a hospital just because I get grossed out, and I'm not talking like the glasses, that's fine, there's no mucous membrane right here. You can always alcohol swab that after. You can't alcohol swab your face, so please don't touch your face. That will really help your family stay safe and help you from contracting it, because as healthcare workers, we're on the front lines. We're the ones dealing with patients with possible symptoms, and that can be a little nerve-wracking. So the things that we can do to try to help ourselves feel more comfortable, and help ourselves feel more aware and more alert and better able to kind of fight this thing, I think will be the best kind of defense. So shout out to all my healthcare workers. This is not meant to offend anyone. It's just my personal tips, and I love you all. I hope that you guys are doing all well. Please stay safe out there. If you don't have to go outside, I really wouldn't. And I get it, people want to go out and socialize and go out and stuff. I get it, life still goes on even with stuff like this, but just think about, if you, touch your nose, you're not just affecting you, you're affecting other people as well, because if you go to the grocery store the next day, you could infect someone or touch something that someone then touches to their face. So please try to protect yourselves and therefore protect the community. We have some immune compromised, elderly, young, and just everyone out there who is nervous. So if you guys have any questions or comments or great suggestions, I would love to hear them. And I hope you guys all stay safe out there. I'm rooting for you. We got this healthcare team. All of us are a little new to this. So we're all doing the best that we can. So I hope you guys have a great day and stay safe. Bye. Okay, so I totally forgot, but another kind of tips I have, one of my tips is I've been wearing winter gloves to work. Just cheap, thin winter gloves. I have them in the basket right now, otherwise I'd show you, but I just wear those to the hospital just so, in case I do have to touch anything, like a door handle or something, it's not like my hands. Otherwise too, besides the coronavirus, I've always been doing this. I use my knuckles to do things, so elevator, kind of use my elbows to kind of get through patient doors or something, to get through the med room, and that kind of helps me feel better. And I also have like a coat that I it's not like a brand new nice coat. Like I'm using just one of like my old coats to kind of go at the hospital, then to throw in the basket and then get washed after every shift. Just so I don't bring that in too. So I also wear long sleeves too, but I've always worn long sleeves for like two reasons basically. One is because I get cold a lot, and another is because if something does get on me, or I just feel better wearing long sleeves. But that's me. So okay, now I'm done, and I hope you guys have a great day, and please stay alert, not anxious. There's lots of good educational videos out there. Just know which ones are good. So I hope you guys have a great day, and for all my healthcare workers, you got this. And for everyone else, you got this too. Stay safe, stay in quarantine, and I'll let you know what happens. Bye.